Welcome to the BDS BOM miniseries, Biology of Meaning. Today we're going to touch on an uncomfortable but necessary topic, fatigue, when simply saying you're tired isn't enough. Fatigue, when the system needs to name it, even if it doesn't understand the process. Today we're not just going to talk about fatigue. We're going to talk about a body that shuts down, a life that can't sustain us, and systems that demand but don't support us. Clinical case taken from everyday life. Arabella, a 42-year-old woman, experiences constant fatigue, has unrefreshing sleep, and has difficulty concentrating, but the biological clinic says her values and other tests are normal. She works long days of 8 hours or more, travels more than 2 hours a day, eats quickly and without quality food, and takes few breaks at work. She lives with financial uncertainty. She goes to multiple consultations. She consults for constant fatigue, lack of energy, emotional disconnection, and difficulty getting through the day. A common response she hears is stress, anxiety, mild depression, and everything is fine. But no one asks, "How are you living?" When she says, "I'm not okay. I'm exhausted," it's a critical point. It's not that her body is failing. It's that her system is unsustainable. The biomedical perspective, which does offer some insight, focuses on measurable causes: anemia, thyroid disorders, infections, sleep disorders, chronic fatigue syndrome, nutritional deficiencies. This is necessary. This saves lives. But when it doesn't find an answer, it often labels things without understanding. And it leaves the real problem untouched, a life that makes one sick. Critical point. Naming is not understanding. Labeling is not supporting. When the system doesn't understand, it often reduces, simplifies, psychologizes, medicates, and the patient is left alone with their symptom. Current clinical practice minimizes, rapidly medicalizes, refers patients without integration, fragments the approach, and no one integrates the complete picture. Therefore, it is necessary to have another model, and that model is Pharaoh. BDS BOM analysis, NMG. From Reich-Geerd Hamer's Biology of Meaning, fatigue can be interpreted as a phase of adaptation, of repair, a biological need for pauses, for withdrawal, a drop in vital energy after a conflict or overload because the system is exhausted. Not as an error, not as a failure, but as biological intelligence. The body slows down to survive. It is not weakness. It is regulation. But note is not a fixed rule. Each person is an individual being. It does not replace diagnosis, nor does it explain the whole picture. Pharaoh integration. This is where the Pharaoh integral method comes in. From Carl Jung's perspective, fatigue can be a withdrawal of psychic energy, a call to examine the unconscious. Jung was clear that psychic energy is not infinite, and when life loses meaning, the psyche withdraws energy. Fatigue can be a loss of direction, an unresolved internal conflict, and a disconnection from the self. From Ken Wilber's perspective, there is no single cause, and his ACL model provides a wonderful clue to understanding Arabella's fatigue. Wilber says that fatigue is not only individual but multi-causal, analyzing each quadrant. Individual interior, consciousness, emotional exhaustion, lack of meaning, internal overload. Individual exterior, body sleep disruption, poor diet, chronic physiological stress. Collective interior, a culture of constant demands, guilt for resting, values versus productivity. Collective exterior, systems, precarious jobs, long commutes, insufficient wages, policies that do not protect life. Herein lies the critical core. 20-year-olds are expected to perform at a level like that of 40, 50, or older bodies. Traditional Chinese medicine, TCM, and medical Taoism, deep energetic integration. This is where ancient wisdom comes in. From the perspective of traditional Chinese medicine and Taoism, fatigue is an imbalance of qi, vital energy. Possible energetic patterns include spleen qi deficiency resulting in exhaustion and heaviness, kidney qi deficiency resulting in profound fatigue and lack of willpower, and qi stagnation resulting in tiredness and frustration. But most importantly, TCM does not separate body from life. Taoism teaches that living against the natural rhythm leads to illness, forcing the body to deplete its essence. The natural system, which is lacking in modern medicine, is often overlooked. No one talks about this. Lack of sunlight, disconnection from the earth, artificial rhythms, constant overstimulation, and the fact that the human body was not designed for this life. Social reality. The forgotten human core that the episode rescues. How can one not be tired when traveling for hours a day, eating poorly, not having enough money, living in fear, depending on minimal aid? That is not a dignified life. That is mere survival with exhaustion. Fatigue is also sustained humiliation, loss of dignity, and a lack of hope. Pharaoh clinical critique. The healthcare system often fragments, labels, and prescribes medication, but it neither listens nor sees. It only treats symptoms, but it does not see life or the existential suffering on the brink of extinction. Pharaoh therapy. Integrated and real. It's not about eliminating the symptoms. It's about understanding and integrating it. It's not just about resting. It's about reorganizing life on all levels. Pharaoh coach role. It helps to see the incoherence between life and body. Works on meaning and direction. Put words to what the body expresses. Help to put lived experiences into words. Identifies invisible overloads. Works on coherence between life and body. Accompany without intruding. Pharaoh nursing. Detects real exhaustion. Observes beyond the symptoms. Humanizes care. Integrates the clinical with the vital. Observes real clinical signs. Detects unverbalized fatigue. Perceives tone, energy, and deep exhaustion. Humanizes care. Not only measures parameters, but also perceives states. Comprehensive intervention. Real rest, not just sleep. Regulation of the rhythm of life. Mindful eating. Emotional work. Review of the work environment with the possibility of teleworking. Reconnection with nature. Pharaoh learning. Fatigue is not always an illness. Often it is the body saying, "This is unbearable." Pharaoh phrase. You're not tired of living. You're tired of surviving. Fatigue isn't weakness. It's a sign of a limit. But in a dehumanized society that rewards hyperproductivity, rest becomes suspect. Subscribe to the channel. Like this video. Comment to help this channel grow. Share this video to raise collective awareness. Study with ECEL Pharaoh and their comprehensive Pharaoh method. Learn science with awareness because in health, knowledge isn't neutral. It's vital.